people are pretty receptive to it for the most part. In some cases, people have approached me to say, we have an open relationship. Is PrEP a reasonable option for me, for my, or for my partner? And I've been very straightforward with telling people what the data is. And I think it's important that people know what the data is, that there's, potentially a benefit, particularly if there are, exposures that you can't define for sure. I actually have not written not one prescription yet, and here's why. Because even though I've discussed it with patients' partners, I don't prescribe anything for anybody that's not my patient. And so what I have done is basically sort of made the recommendation to them that PrEP might be a good option for them, and recommended that they get it under the care of either their doctor, or that they could see me, but they need to see me, not so if I'm sitting here with you and we're here with your visit and your partner just happens to be here with you, I will have that conversation, but I'm not just going to write them a script, just because the important thing is that people be under a doctor's care if they're going to be on PrEP. And so I don't want to just start something that's not going to be an ongoing thing. It has to be something where they have a relationship with the doc. So that's why I haven't written prescriptions personally yet. But I would say that there's probably 5 or 6 patients that I have recommended PrEP as an option for them. Well, so any person that is particularly MSM. Why particularly MSM? Because of the higher risk in the community, so a higher community viral load per se in MSM communities, particularly MSM communities of color. So any person who is having sex, either unprotected or not unprotected, and doesn't know their partner status, or knows their partner status and their partner is not on medicines and not undetectable, they would be somebody who should really think about being on PrEP. So I think the more tougher group of individuals to define is heterosexuals who may be in somewhat high-risk relationships, but it's tougher to be able to define who's high-risk relationship or not in heterosexual communities, just because, again, the prevalence of HIV disease is not as high, so the risk-benefit equation is more complicated. I think that's probably why the CDC hasn't really come out with those recommendations yet, because it's a tough proposition. But for MSM, the CDC has, and then I think the CDC does a pretty good job of defining who might be at risk. And so I think more providers need to be thinking about it if they're taking care of a population of MSM. So, and I say that, and I underscore, if you're taking care of a population of MSM, whether you know it or not, because that's part of the challenge, is that I think there are a lot of folks that take care of men and don't take good sexual history, and may not even know that they're taking care of someone who may be at greater risk. And so I think one of the challenges around PrEP is that because it's a HIV negative population who would be the people who are candidates for it, they're not being seen by the folks who have the most knowledge about PrEP. And so it's definitely something we have to talk about more in order to have people, the general clinician population, more aware.
Yeah.